Back at the National Assembly, where the Senate has advanced a bill seeking to criminalize drug hawking and impose up to 15 years imprisonment on offenders. Lawmakers also progressed a separate bill aimed at accelerating the digital transformation of the country's healthcare system through electronic health services. National Assembly correspondent Jesu Adeoye has more.
The Senate has passed for second reading a bill seeking tougher sanctions against the production and distribution of counterfeit medicine, fake drugs, and unwholesome processed foods. Sponsored by Senator Umar Sadiq Suleiman, the proposed legislation seeks to replace the existing law with a more robust legal framework capable of tackling emerging threats such as online drug sales, cross-border trafficking, and organized criminal networks.
Counterfeit medicine has become an extremely profitable organized criminal enterprise. Accordingly, this bill ensures that offenders not only lose their liberty, but also forfeit the proceeds of their criminal activities.
The bill criminalizes the production, importation, transportation, distribution, sales, and possession of counterfeit medical products. It also prohibits hawking of medicine in markets, motor parks, roadside stores, buses, ferries, and unlicensed online platforms. Under the proposed law, offenders could face up to 15 years imprisonment, hefty fines, and compensations for victims and their families. While senators overwhelmingly supported the bill, some lawmakers cautioned against creating overlaps with existing regulatory agencies, insisting the legislation could complement, not duplicate, the powers of relevant institutions.
It is only fitting that we rise as a Senate to send a clear signal that these abuses must stop and that penalties must be invoked as appropriate to serve as a deterrent, to protect health, to protect lives in this country.
Meanwhile, the Senate also passed for second reading a bill sponsored by Deputy Senate President Barrow Jibrin, seeking to establish a legal framework for electronic health services and fast-track the digitization of Nigeria's healthcare system through electronic medical records, prescriptions, and other digital health services.
Through telemedicine, patients in remote areas will be able to consult qualified healthcare professionals without traveling long distances, thereby improving access to quality healthcare and reducing pressure on tertiary hospitals.
Bills have now been referred to the relevant Senate committees for further legislative action. Jesu Adeoye, TVC News, Abuja.